Welcome to the Mostly PT Podcast. I'm Brant Bomer.
I'm Alex Bretzman.
And today's episode is non-sponsored and then unpaid by Great Value Drinking Water. Forever water, never plastic.
Take a sip of that.
One sip, everyone knows the rules.
Take a sip of that bad boy. Hydrating?
Yeah. Oh, purified. Okay.
What would you grade it out of 10? 6, 7?
6.5. Welcome back.
Welcome! It's been a minute.
It's been 2.5 months, I think. We might go to quarterly.
We might go to quarterly.
We're just going to get right to it.
We're just gonna, you know what? Yeah.
The NPTE practice questions.
Got to start it up hot.
3 of them.
From September 2nd, 2025. A patient with bilateral transfemoral amputations presents to a physical therapy for wheelchair mobility training on an inclined surface. What modification is the most appropriate to reduce the risk of the wheelchair becoming unstable during ramp ascension? A. Addition of posterior anti-tippers to the wheelchair.
It's probably that one.
B. Addition of anterior anti-tippers to the wheelchair. C. Reclining the wheelchair 10 degrees posteriorly. D. Tilt the wheelchair posteriorly by changing the front caster alignment.
A.
A is correct. Great job. You're off to a hot start. He's 1 for 1, folks. From September 3rd, 2025.
September 3rd.
Sorry, I'm sick. I need to articulate and project my voice.
Thank you.
Sorry. Okay, second question. A K2 level ambulator with a unilateral transfemoral prosthesis is learning to ambulate.
Hold on, you need to restart the question.
I'm going to tell you right now, it probably doesn't matter. A K2 level ambulator with a unilateral transfemoral prosthesis is learning to ambulate up a steep incline, roughly 20 degrees. What technique is most appropriate to navigate the steep inclination? Lead with the prosthetic limb and ambulate in a reciprocal gait pattern. B, lead with the contralateral limb and ambulate with the reciprocal gait pattern. C, lead with the prosthetic limb and ambulate with a step 2 gait pattern. Or D, lead with the contralateral limb and ambulate with a step 2 gait pattern.
Doesn't he only have one limb?
He has he's a prosthesis on one.
Transtibial?
Transfemoral. So above the knee.
They would consider that a leg?
Yeah. Limb.
Oh, limb. Okay. I was thinking about that, so I didn't really...
Yeah.
You would lead with your uninvolved side.
Okay.
And then step to it, whatever answer that is.
That would be D. That would be correct. Great job.
Thank you.
Good leg goes up. From September 4th, today, 2025. Neuromuscular, level advanced. This one you might not get, I guessed. A physical therapist working in a high school setting has an athlete come into the treatment room complaining of a headache, fever, and a painful neck. The therapist positions the athlete in supine and flexes the hip to 90 degrees.
Oh,
When the
this is bad.
This is bad.
Hold on.
Okay.
Okay.
What do you got?
I thought I was gonna answer.
What do you got, boy?
No.
What do you got? What do you got?
No.
What is it, boy?
It's very specific though.
Okay. When the therapist
Some kind of infection, but
yes, you're correct.
I think it's in the brain. What's the brain?
So what's
infection?
that? What would that be called?
Meningitis.
There you go. All right, we're almost there.
Dang.
The therapist positions the athlete in supine and flexes the hip to 90 degrees. When the therapist attempts to extend the hip in this position, the patient complains of significant pain. Which of the following is most consistent with the scenario? A positive Kernig sign, a negative Kernig sign, a positive Brudzinski sign, or a negative Brudzinski sign?
Positive Brzezinski's. That just sounds better.
It is Kernig's.
Kernig's.
I had to guess. It was. I knew it was probably positive, but we haven't gone over meningitis stuff. But
Props to that PT for knowing to flex their hip, because would that be your automatic?
Your
headache,
it's just
fever. Let me flex their hip.
It's and headache, fever, painful neck, and they probably can't walk.
And you'd go immediately. Let me flex your hip.
Well, young kid, if it's patient demographic, athlete, meningitis, boom.
But you would
I don't know. We haven't talked about it yet.
But you would go, let me flex your hip to see if
If
you
I
have
was-
meningitis.
If this is the test, and I knew that I was suspecting meningitis, and it was my primary hypothesis.
Why do you think that's a positive? Like what is the mechanism behind flexing the hip?
Positive Kernig sign is characterized by pain that is present when a patient is positioned in supine and cannot tolerate a combination of passive hip flexion and knee extension. The pain results from inflammation of the meninges within the spinal cord.
i.e. meningitis.
Brudzinski's sign occurs when a patient is placed supine, experiences pain with passive flexion of the neck. Passive neck flexion will also produce hip and knee flexion since the patient attempts to decrease neural tension caused by the progression of inflammation within the meninges.
That's gotta have a high specificity.
Probably high spin and high snout.
Yeah.
Good special test. All right. That was great. We're back.
Yeah.
We're so back.
We're back.
Want to know what else is back? You know what else is back?
Football.
Football's back.
It's on right now.
We're watching Thursday night game.
America's team.
Go Cowboys.
All right.
Sorry.
Now on to the meat and potatoes.
That was weird.
This is what you all came for.
All right.
Would you rather?
Let's try not to get canceled.
Would you rather spend 1 year at war or 1 year in prison?
Okay.
Are we going to put any stipulations to this before we answer the question?
Extremes. Like, it's not like Swedish.
You're not
Swedish
getting.
prison.
I was going to say, okay, yeah. You're not going to go over to overseas and you're accounted. All right, you're in the battlefield.
You're
front
actively
lines,
at war.
front lines, and it's like World War II or something. You know, like a war that I don't know.
Well, okay. Let's just
war.
say you're in active combat.
What do you think of war?
Active combat.
Active combat.
Active combat.
And then prison
is like
Alcatraz.
No.
That's a prison.
Yeah, it's not in commission anymore. It's a museum.
I'm just saying. That's a worst case. Alcatraz. That's scary. Scary stuff.
High violence rate, a lot of fighting.
I mean, most prisons have a high violence rate.
Well, some prisons.
That's why they're in prison.
Okay, it's the worst of both situations. So, which one are you taking?
I'm gonna go to war.
I think I'm taking prison. I think the chance of survival is higher.
I won't even say it's about that. I'm gonna fight for my country.
Are
you gonna go to prison for your country? No. This is a heart thing. I'm gonna go to war. If I die, it's for my country.
Okay.
You know what? If you go to prison, it's only for yourself. That's selfish.
Time out. 30 seconds. We come up with these before we obviously start the podcast,
And
right?
That's not what I said.
Just listen. We come up with these questions before we start the podcast, like every good podcast does. We have a list of questions we're going to talk about, and see, there it is right there. That's the prep sheet. And we kind of discuss, like, maybe what our answers would be. We saved the debate for the live shot. Brant always comes up with an answer that is completely unrelated to the question and sways it his way.
That's what a debate is. That's what good debaters do.
Welcome to politics in the Big 2-5. I'm taking prison because it is legally their job to not let you die. In war, like...
I'm not afraid of death. I know where I'm going.
You're so him.
It's not about that. Like I said, it's about the country. It's about America.
Well, I'm trying to think of...
You're trying to think of a rebuttal to that.
I'm trying to think of what has the higher survival rate, and I think prison has the higher survival rate than an active duty war zone.
Yeah, so our intentions of why we would do it are different.
You're going...
I'm for America, you're for yourself.
Vote Brand 2028 president.
I'll just be in the APTA committee.
You should get on the board.
I would not be good at that.
You'd be terrible.
That would be terrible.
They need a young and spry PT that just, like a new grad, that just has so many ideas and can connect with the younger new grad audience.
I could do that. It's just I'm not professional enough.
You show up and...
You probably have to wear a suit.
You'd show up in shorts and tights.
I don't wear shorts.
Well, whatever.
Like yes, tights I would.
Yeah, you'd come to a board meeting in a polo and they'd be like, what is going on?
Hey. What's his name? The guy who created Apple.
Steve Jobs?
Yeah, he didn't wear shoes or socks.
He was also the CEO.
Okay.
You know he left Apple and came back?
He's dead.
Yeah, cancer.
RIP.
Yeah, R.I.P. Next question.
All right. It's hard to just transition.
We are so back.
Scenario-based question here.
Oh.
Here we go.
This is a great one.
You better think about your answer.
I have my answer.
You want to say the question?
It's the
Okay, so
you got it.
for $100,000 a day, how long would you go without showering? Can't touch water. Can't go on. You can't jump into a lake.
You cannot bathe.
Any kind of
can't bathe.
You cannot cleanse yourself.
I'm glad we agree on that. Like,
Both
I
physically and spiritually.
This would be your loophole of I just go and swim in the river. And
I did think about that, but I was like, hey, I should probably stipulate that because that would be way too easy.
The realistic answer, in my mind, in like continuing to live your life.
Here's what I found.
Thanks, Siri. I don't care what you found.
I would like to hear your answer.
10 days.
Really?
10 days. I think it's a mil. I think that's my limit. You can't
That's crazy.
Like you go to the gym and you smell yourself after. You're like, oh my god. Like,
Don't go to the gym for 10 days.
You still like accumulate.
Why?
Your body is constantly exfoliating and stuff. Like it's just disgusting.
Okay, so you took into consideration the $1 million. Like $1 million, that's enough to live on. Like that's good for you.
Right, and I think after day 3, I would be like, this is
taxed? Is this taxed?
We'll say untaxable dollars.
Okay.
It's imaginary money. How long could I physically possibly go? Like,
that's a totally different question.
Yeah, but I'm saying like my choice. I think realistically, and still like you could go out in public.
You definitely could.
Well, people would just.
And I would say, get away from me. I'm making $100,000 a day.
You have a lot less. I don't know if shame is the right word, but like just not care for public reputation.
Skin. I'm comfortable in my own skin.
Obviously, if it reeks, yeah, you are. I think 10 is the good, like, that's the over-under
also
for sure.
living comfortably, because I'm going to be doing
it
for at least 3 months. At least 3 months.
That is so ridiculous. There's no way. There's absolutely no way.
I would be able to do it.
You would be disgusting.
I would be disgustingly rich, too.
Your family would disown you.
Yeah, for 3 months, maybe.
I would not be your friend.
Then I'll be back, and they'll be, hey, here's a boat. Here's a house, because I have, what's the math? 3 months. 90 days.
Can you do it?
Times 100,000.
Can you do it?
Let's see. 900 million. Wait, 90 times 100. Yeah, 900 million.
No.
Really? 90 times 100.
It's
90.
It's 9 million.
No, it's not.
It's 90 times 100,000. You add a 0. It's 9 million. 9 times 1 with 6 zeros.
Wow.
So 9
million.
million.
Learn that in algebra.
That's
wow. So then so 10 days you're getting $1 million already?
Yeah. $1 million 10 days without showering. Sign me up. 90 days for only 9 million?
Oh heck, I'm going a year. No,
that's
6 months.
That's ridiculous.
9 million's not that much nowadays. Now this is the question
I'm
where
like,
I'm going to be selfish.
I'm still like imagining like I have a career future. I'm not doing it to like retire. I'm doing it to like, I get $1 million, I can continue to live my life comfortably. Like, I'm thinking of like, I have to continue life after.
I would continue life after as well, because I would take a nice bath after those 6 months.
Can you imagine how disgusting that would be?
I feel like there'd be other health
definitely
things that would go on where I would probably not be okay. I don't really.
Do you know the dirtiest man in the world or whatever didn't shower for like 23 years and he was covered in just dirt?
He obviously lived to be 23.
No, he was like old.
Oh, so it's good for it's okay for your health then, probably.
Yeah, but imagine your quality of life. Your quality of life definitely starts to decline.
I bet you I could figure out to like, if I'm getting $100,000 a day, like be in a room where the air quality is just so good that you don't get dirty.
Yeah, but your body just excretes stuff and it would just be gross.
I mean, there's nothing in the question that'd be like, use deodorant, use spray. You can definitely do that.
Oh my God.
You definitely could. Like, that's very...
Yeah, but okay.
You very well
That's putting lipstick on a pig at that point. Like, that's still gross.
I mean, we eat pig, so...
Yeah, that's totally unrelated.
It was.
Let us know in the comments how many days you could go without showering.
Wow, I'm bad at math.
Yeah, that was
90 times 100,000.
That was almost as bad as your state debacle.
I got anxiety, and then I was like, oh, I'll pick a number. And I knew it started with a 9.
You could have went 900 in like 3 years, 2.5. How many days are in a year, Brent?
365.
How many days are in 2 years?
6.
Nope.
10. I'm doing the math in my head.
Okay.
120, 10, 130, 830
Nope. 730.
We should redo the podcast.
This man
All
has
I know is physical therapy.
This man has
If you ask me a math question, I'm not getting that right.
All he
I
knows-
know the Pythagorean theorem, that's about it.
This man is a doctorate in physical therapy, by the way. All he knows is how to calculate total volume of sets and reps. Can you do that? Like sets, reps times weight?
I really don't that much. I just lift until I can't lift anymore.
Yeah, just go to failure. You're just huge, gym bro. All right, next question. We're moving nicely.
All right, now on to the steak of the meal.
The steak and potatoes.
I said meat and potatoes before, and now I'm going the steak.
Steak and carbs.
Okay, I'm not
Steak and
going to
starch.
respond to that. Are we? So we're gonna go through some scenarios in PT, some snippets, and we're gonna say, are we for or against?
And then
should we say why we picked these?
Okay.
Is that allowed here?
Yeah. So we've got like 4 questions.
No, like why we picked these, like with, or no?
No, because the how we picked them, they'll understand.
I'm saying with
for
school,
a specific
with
population.
school, like
no,
why?
no.
Okay.
I'm saying the people that need to know. Know what I'm saying?
Okay.
Yeah.
You know.
If you know, you know. You know. Get it?
Yeah.
Yeah. Hilarious. So we have like 4. This is the PT segment.
4 snippets.
We have like 4 tiny little snippets. Agree or disagree. Say I agree or I'm for or I'm against it. Give like 1 minute blurb and we'll see where it takes us. Probably won't be a minute because we'll probably eventually disagree on something.
Yeah, it's not going to be. I mean, I'll
This is
try
gonna be
not to
great.
purposely disagree. But
Yeah, don't play devil's advocate. The devil knows.
I
your
don't know if
address.
I mean, I could. Yeah. All right. Here we go.
All right, question 1. Hit me.
Question. It's not a question. It's a snippet.
Oh, snippet.
Are we for or against spinal flexion with deadlifting? So, for all the
Don't bend your
non-physical therapy people out there, I feel like that's just not a good statement to say. For all the people out there that don't know what spinal flexion is, it's this.
Yeah, show them an RDL here. That's good. It's a great Jefferson.
And this would be against it. Or for it. No, you'd be against it.
This would be against spinal flexion. You're keeping your back as straight as possible. Look at that form. Should we say our answer, like count down 1, 2, 3, say for or against? So like 3, 2, 1.
Yeah.
Okay. Ready? You got your answer?
Yep.
3, 2, 1.
4.
We are both 4. I like it.
Should we just go on, or should we?
I think, no, we have to explain why we both said 4. I'm for it because our spines are robust creations and we are meant to move. And if we stop ourselves from allowing our spine to curve, it probably leads to more bad than good. Now, I'm not telling you to go load up 405 in the deadlift bar and lift with your spine.
Why not?
Because you should introduce it at light loads and then gently work up. That's how you should do every single exercise. Trying it out for the first time new. But actually curving your spine and increasing spinal flexion, very good for your back and intrinsic muscles within your spine.
Yeah. I like spinal flexion because think about it throughout your day. You pick up something off the floor, you're not picking it up like this. Oh, I dropped my pencil.
I've seen people do that though.
Okay, yeah, they have back pain probably. Yeah. But for someone that just doesn't, like, they don't have any pain, they don't think about it, they're going like this and they're picking that up.
I
At
do
least
all
that's
the
what
time.
I do.
I do it all
So,
the time.
it's a very functional movement, right?
Right.
So, like, why not do that? Okay, I also think we should do this with these snippets. What are some specific cases where we would be against spinal flexion? That's non like post-op.
Oh, that was my answer.
Mine would be sports.
I'd say like disc herniations early on. Does that count?
Yeah, it would.
Yeah. Obviously you want to work in spinal flexion, but promoting extension first. But those are the people that are really likely to guard and not go in, just never move their back the rest of their lives because it hurts as soon as they herniate their disc going forward. So and then they're like, I'm like, well, this feels great. I'm not going to bend forward. Okay, we won't bend forward for the first, but we're going to work into it eventually, but not today.
I think sports would be a case.
I think
Because
yeah, why?
2 reasons. One, let's say you're doing it, I'd say you can repeat it a lot easier when you do it a certain way, like, all right, keep a straight back, do it the way that's usually taught. You can easily progress that. Like, with spinal flexion, right? How much are you flexing? That's hard to like. You're gonna flex this many degrees when you're doing it. So how do you fix that throughout when you're progressing them? You probably can't. When you're doing it the other way, it's very repeatable.
So you're saying,
And that's good with sports. You want to progress.
because keeping your back straight's more of a simpler movement, it's
Well,
easily repeatable and you can increase loading
Yeah,
stronger.
I mean, to be honest, when you're doing it with an erect spine, your lumbar spine's actually usually flexed or actually in neutral.
Right.
Like it's not extended. There's some flexion.
Plus you're
Most
getting-
likely when you're deadlifting the right way.
You're going to get isometric contraction of your spinal erectors too, for keeping you up straight. But I agree with that. I don't know if it's the total like end all be all like sports people shouldn't flex their spines. When they're
No,
doing
I'm just
something
saying
like
why would it be against that? Like I'm probably not going to have.
I'll buy that.
Jefferson curls when they play football. When are they doing that motion in football? Not a whole lot.
that. Well, the center.
Not a whole lot.
Yeah,
So
not-
maybe some.
Yeah, that's not really a sport.
In center, they're not a freaking frog, but
long snapper.
okay. All right, next one.
I like
We
this.
tried to keep these under a minute. That was probably 4 minutes.
Yeah, whatever.
Core stability exercises for low back pain. Oh wait,
Yep, we're good. Let me say, you got your
Yep.
answer? All right, 3, 2, 1,
4.
Good.
We're gonna go 4 for all of these.
Uh,
Actually, not. One of them not. Okay.
yeah, one of them not either.
All right, I'll start it off with 4. There's nothing wrong with core stability exercises. The thing that I think this snippet is pointing to is the reason why you do the core exercises for low back pain, as in what are you explaining to the patient of why you're doing that. That's what I would be against, but I'm totally for core exercises. They can be helpful with low back pain because you are moving your back and you're moving. So usually a lot for most non-specific low back pain, really any motion's gonna probably be better off than doing nothing. So go for it.
I'm with you on it's generating movement in your low back or anywhere in your back, basically. That's what I'd be more for it for, not like specifically like, oh, we need to straighten your core is weak and that's what's causing your low back pain. Don't know how much really truth is to that. I don't know enough about it. That's what we're basically getting into right now in MSK.
I don't think there's no correlation between like having a weak core and low back pain. To my knowledge, I don't know
I
if
would
the
say
research
that,
has
yeah.
changed, but when we learned it,
I'm more on Brand's side. It's more for you're moving your back, and that's better than actually targeting a specific muscle and trying to strengthen it. So
I actually heard that with chronic low back pain, there's more correlation between having like your two, how do you phrase this? Like you're using your abdomen way too much with a lot of exercises. Like you can't relax at all. Like when you flex, right? You're trying to brace, like actually teaching someone to relax and bend down can be beneficial for like chronic low back pain compared to the opposite way you'd think. So tighten your core up, brace.
and they're already pretty tight. Yeah,
But I don't know. All right,
you digress.
next one.
Okay.
Using manual therapy for MSK care.
Ready?
We already, if you can go back to the other episode, of what manual therapy is. That's manual therapy, kind of.
Kind of.
Right.
Ready? 3, 2, 1,
4.
Shocker.
Yeah.
I love manual therapy. Big manual therapy component.
Manual therapy.
We just talked about the latest CPG on low back pain, acute and chronic,
Yeah.
and how manual therapy was an A grade for both. And when it came out, you would have been
Only manual therapy
no, with conjunction with exercise, but manual therapy by its like
and education.
yeah, education, exercise, manual therapy. Manual therapy is rated an A if you combine all three. You want to look up the CPG?
No, I'm not questioning you. I'm just. Then what were
Thrust or non-thrust manual therapy was found as A evidence
Oh.
in treating chronic and acute
Okay.
low back pain.
and acute?
And acute. It was A graded for both, which is actually kind of shocking.
What was exercise?
B's.
Really?
Mm-hmm.
That's interesting.
That because okay,
And chronic.
this came out. This study came out when you were a first year student because we talked about it today in class. That's the year we talked about it, and it was like on Twitter, it was like an uprising because all the manual therapy haters were like, "That can't be right."
For long-term outcomes. Oh, it's
For-
just the grade. Okay.
That's the grade. Just read that's what the CPG said, man. I'm not.
But you said manual therapy combined with exercise education. But then
No.
Oh, it's just by itself.
Sure. Exercise alone can't be used alone. Or education alone shouldn't be used alone. Like pain neuroscience should be used. That was graded an A, but it cannot be used by itself.
Yeah.
Right.
So
Manual therapy, good.
okay.
Therapeutic touch, good. Your patients build therapeutic alliance the more you touch them. I think.
Yeah, I mean, yeah.
I talk about this a lot.
There's some people that don't like to be touched.
Some people don't, and then that's great. Then you can just be all exercise based.
Would you do the same? Oh, here's a good question though. Someone who hates exercise, would you just not do exercises then?
If they got better with manual therapy, yeah, and they weren't going to be a chronic like coming in all the time just because they want their back massage. You know what I'm saying? But if they got better in 4 sessions with manual therapy and got better every time, heck yeah, let's do manual therapy 30 minutes.
You could gradually expose them to manual therapy if they hated manual therapy.
That'd be good.
I don't know why.
All right, I'm just going to hold your hand, and then next week we'll work on your elbow extensors.
Yeah, that'd be weird.
My CI and I talked about it a lot in my last clinical. It's just people like, he described it as like heavy hands, just people just holding them, like moving their hips through PROM and stuff like that. Just people enjoy that.
Heavy hands?
Like you having heavy hands, like putting your weight into them.
Yeah.
And people like that.
That does come with experience.
I mean, think about it in class. When like we did it today doing CPAs and EPAs, and I'm like, this kind of rocks. Like if my back hurt, I would definitely want someone to do this to me.
You can definitely tell if someone's like experienced in that way because like there'll be students where you can tell they've never touched a neck. Or
Totally.
And it changes how you feel. Like you're like this. Like they'll touch your head.
Yeah, first year you're doing that today. Yeah, it's kind of funny.
All right, last one. You should say this one.
Can I see the question?
It's about prescriptions.
Yeah, I know. Are you for or against therapists having the authority to prescribe medication? Ready?
Yeah.
3, 2, 1.
Against. Shoot.
Did we just go a whole episode with agreeing on things about PT? That's crazy. Why are you against it?
I think we would be stepping out of our scope of practice.
I think...
And I don't think it would benefit... It would be... You would not... It would be less beneficial compared to, like, the risks of it. Like, we already have so much medications that are prescribed. Why would we need another profession to prescribe it?
Yeah, I think it's... You're trying to get too cute with it, as the kids would say.
And it's like, I really want them to take a drug. Refer them out. Like, it's not...
Right. Our whole profession is kind of advocating against using drugs. And I think that just...
Don't do drugs, kids.
Well, using pain medication and other things. Here's the problem is I don't know what, like... For using medication, what are we able to prescribe? Like beta blockers?
No, the only thing you can do is...
over-the-counter medication?
Is, with ultrasound, you can have... What do they use with ultrasound?
Ionophoresis?
Yeah,
like
that's a drug.
Yeah.
Yeah. That's about it. Some creams you can use.
It'd probably be very, very like low on like the FDA drug class and stuff like that, like class 1 medications, like things you can just go and get over the counter with a relay prescription.
All right, so you're saying would they be allowed to because right now you can't even recommend drugs. Like,
right.
I would recommend doing this.
Yeah.
You really shouldn't be doing
do
that. But I would be okay for acute situation. You know what? What's wrong with taking ibuprofen for a little bit? But I would rather not. I would rather stay in my scope than be able to do
I think you're creating another thing that doesn't need to be had right now. I think the main argument for it is we go to school for so long and we're so educated and we have the knowledge to do it.
We don't have enough knowledge for that, I don't believe.
Well, they're probably going to put it in the curriculum at some time.
We already take...
We want to get paid more, and that's just another thing you can advocate for the profession is, hey, and now in this state you can refer for radiographs and other imaging. And
I don't know if that correlates to more pay though.
It's just another thing
I
you have
think
in
the
your
pay
toolbox.
correlates to how much is physical therapy needed.
Well, depends on what setting you're in. Any final remarks? I thought this was a very I wouldn't say classic episode, but I think it was one of our better calm.
It was a Jordan episode.
It's Mike. Be like Mike. Episode 23. I like it.
We'll catch you next time. Mostly BT Pod out.
We'll see you next time.